Laos is at high risk of a major community outbreak of COVID-19, meaning strengthened control measures are essential. According to the minutes of the meeting on Monday, signed by the Deputy Head of the Prime Minister's Office, Mrs. Thipphakone Chanthavongsa, travel to and exit from red zones infected villages is prohibited. In the capital, travel on roads is forbidden from 10 p.m. to 5 a.m. A recent meeting of the Task Force Secretariat Committee agreed that control measures need to be more strictly enforced to contain the deadly virus. The government is concerned about the rise in new cases, notably in Vientiane and the provinces of Savanakhet and Bokeo, saying that locally transmitted cases in these areas should escalate to level 3, COVID-19 high, major community outbreak. In the capital, travel on roads is forbidden from 10 p.m. to 5 a.m. Indoor and outdoor sports are also prohibited, while the start of classes this academic year has been postponed in Vientiane. The meeting of the Secretariat Committee instructed the capital authorities to early define red zones and strictly enforce the measures relating to these areas. In addition, the sectors concerned were asked to carefully examine proposals made by private companies, requesting the hire of foreign workers in Laos and ensure that the number of foreign workers hired is in keeping with actual requirements. The hiring of foreign technical staff and workers by travel companies is prohibited. The Secretariat Committee of the National Task Force have been advised to propose extra measures without waiting for the government's existing COVID-19 rules to expire if community outbreaks are reported in the provinces. Laos is still struggling to contain the spread of the COVID-19 as almost 2,000 migrant workers cross the border from Thailand each day, with at least 30% of testing positive for the virus. The Secretariat Committee noted that new cases had been reported among groups of state officials, company staff, and family members. It's critical to trace infected people as soon as possible to limit the number of locally transmitted cases.